No, I do not have a specific anesthesia time cut point, and my concern with the discussion around this is I have heard specialists giving cutoffs, and I do think that that is somewhat dangerous because just like every anesthetic protocol should be modified to the individual, the amount of time under anesthesia needs to be considered. One, how is the patient doing? So if the patient's doing great, vitals are all normal, and we've just got a little bit of work left to do, I would much rather have a 3-hour anesthesia than a 2.5-hour anesthesia, but have everything done. So it's been a little while since I looked this up, so if any of you know differently, please let me know. But the last I checked, there is no literature to say that there is a cut point at which anesthesia must be stopped. There is one, and this was a conversation that we had in my residency because we were constantly being told they're under too long, we need to wake them up at like 2 to 3 hours, but then there might be an Explorer TPLO that was under for 4 hours. And so my pushback would be, why is it that for oral care we can't have them under as long as another surgery? And I do think that there's this, even if we don't mean to, there's this idea that oral health and treating that oral health isn't as important as another surgery, which obviously I couldn't disagree more. So for me, it's about, is this patient doing well? Are their vitals well? And we're 2/3 of the way done and we're at 2.5 hours. Does that mean a total of 3.5 hours? So I personally would much rather have a slightly longer single anesthetic event than shorter but two, because we know the biggest risks are often at induction and recovery. Keeping in mind that the longer the anesthetic event is, the higher risk of potentially hypothermia, hypotension, bradycardia, or things that then could be a problem. However, if they're, like I say, cruising along, my anesthetist or technician is happy, then I want to get all that work done. I will say, humble brag, I'm a dentist oral surgeon, so I am fast, and so I can generally get full mouth done in a cat or small dog in an hour, hour and a half, in a large breed dog 3 hours. So there is going to be that difference. Also, I understand the physics of doing extraction, so I'm not having the same fatigue that some of you are experiencing depending on your technique. So these are all things that need to be considered.